IELTS Part 37, Obsessive Compulsive Disorder. OCD symptoms generally begin between the age of 10 or 24 and continue indefinitely until a person seeks treatment. A child's upbringing does not seem to be the part of the cause of disorder. Though stress can make symptoms stronger, the underlying cause of OCD have been researched greatly and point to a number of different genetic factors. While studies show that OCD and its related anxiety disorders are often passed down through the families, the specific symptoms for each family member are rarely the same. For example, a mother who is obsessed with order may have a son who can't stop thinking about a single word or number. Research on OCD sufferers has found certain psychological, rather physiological trends. In particular, many studies show an overactivity of blood circulation in certain areas of the brain. As a result of this increase in blood flow, the serotonergic system, which regulates emotions, is unable to function effectively. Studies have also shown that OCD sufferers have less serotonin. As they have less serotonin than the average person, this type of abnormality is also observed in Tourette syndrome, attention deficit hyperactivity disorder. People who developed tics as children are found to be more susceptible to OCD as well. Many reports of OCD point to the infections that can trigger the disorder, namely the streptococcal infections. It is believed that a case of childhood strep throat can elicit a response from the immune system of the producers certain neuropsychiatric disorders such as OCD. Because OCD sufferers tend to be so secretive about their symptoms, they often put off treatment for many years. The average OCD sufferer waits about 17 years before receiving medical attention. As with many anxiety disorders, an early diagnosis and proper medication can lessen many of the symptoms and allow people to live fairly normal lives. Most treatment plans for OCD involve combination of medication and psychotherapy. Both cognitive and behavioral therapies are used to teach patients about their disorder and work through the anxiety, while serotonin reuptake inhibitions that are prescribed to increase the brain's concentration of serotonin. This medication successfully reduces the symptoms in many OCD sufferers in short amount of time. For the cases when OCD is linked to the streptococcal infection, antibiotic therapy is sometimes all that is needed. Well, we do have certain things. Over here, there's a tip for false no, not given as well. False or no means that the statement contradicts with the information in the passage. Not given means that the information is not stated in the passage. So it can be false, it can be true, and it can be not given or not stated, as might have been the case over there. So you can accordingly go along with it, read the passage, and then find your answers. We'll do the following statements. We'll see if the following statements agree with the information in the reading passage. In space provided for question 9 to 16, we can write true if the statement is true according to the passage. We can write false if the statement contradicts to the passage. And we can write not given if there is no information about this in the passage. We can accordingly mark them question 9 to 16.